Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Ivy Plastic Surgery Associates in Chevy Chase, Maryland, discussing advances in body contouring with laser lipo and how it can give you the shape you've always desired with one of this area's top plastic surgeons, Dr. Marwan Khalifeh. Dr. Khalifeh graduated from the University of Pennsylvania and earned his medical degree from Vanderbilt University. He completed his residency and plastic surgery fellowship from the renowned Johns Hopkins University in Baltimore, Maryland. Dr. Khalifeh is a member of the American Society of Plastic Surgeons and the National Capital Society of Plastic Surgeons, among others. Welcome, Dr. Khalifeh.
Thank you, Rocco. Thanks for having me on the show.
Oh, it's our pleasure. We have a lot to talk about. So let me begin, if I may, by asking you to please tell us what laser lipo is.
Well, laser liposuction is the latest technique in body contouring, and it's as compared to traditional liposuction, it's less invasive. It's usually done with the patient awake and in the office rather than in the operating room, so you don't need general anesthesia. And it has a shorter recovery period. And as compared to traditional liposuction, it adds the benefit of a little more skin tightening because of the laser energy that's delivered beneath the skin.
How is this performed?
Well, the patient is awake during the procedure, and we clean up the skin, and we start the procedure by inserting a little bit of fluid that will help melt the fat and help control any discomfort. After that, the laser energy is inserted via a needle hole, and we deliver the laser energy into the fat region, which helps melt the fat, control any bruising, any bleeding. And that's probably the longest part of the procedure, which takes about an hour for each area. After the energy is delivered, then one can suction out a little bit of the fat or just leave it alone if it's a small area, and the body will reabsorb it.
Very interesting indeed, doctor. And I wanted to ask you, what types of problems are we looking at as far as laser lipo addressing?
This is not a weight loss operation. It's the amounts removed are usually up to 3-4 pounds at a time, and so this is not a substitute for a healthy diet and exercise. However, when my patients have stubborn areas that are just not going away with their lifestyle changes, then laser liposuction is a perfect, minimally invasive way to address those concerns.
That's very interesting, Dr. Khalifeh, and I wanted to ask you, what types of problems would laser lipo address?
Well, laser liposuction is for small, stubborn areas of fatty deposits anywhere in the body that are not responding to a lifestyle change with a healthy diet and exercise. So this is not a substitute for weight loss. However, during a typical procedure, we're able to remove 2 to 3 pounds from an area that bothers the patient, and we can help them achieve their desired goals in body shape.
So that's a great option based on what you just described here thus far, because you're talking about a non-invasive procedure as opposed to traditional liposuction.
Minimally invasive.
Minimally invasive.
This is still a surgical procedure, and one has to seek a board-certified plastic surgeon to perform it. In the wrong hands, it can be dangerous. This is still considered a surgery, and all the precautions of a surgery are taken into account. However, as compared to traditional liposuction, it does not require general anesthesia and is well tolerated by the patients, and the recovery is a little bit faster.
I wanted to also ask you, what body parts are we talking about as far as where the laser lipo can do its work?
Well, the most commonly treated areas tend to be the abdomen, the flanks at the same time. Then we can also treat the thighs. The fourth most common area that we treat is the neck region.
So it can handle those various areas that you just mentioned, take off a few pounds of unwanted fat that we haven't been able to lose thus far with traditional options that have been available, but now with laser lipo, that's all possible.
Absolutely, absolutely. And this is done in the office while the patient's awake. And my patients generally return back to work in about 48 hours. So this is a very good option for people that don't want to take too much time off work to get those shape changes that they're looking for.
Talk about a very quick recovery time.
Absolutely, and that's thanks to the increased hemostasis or blood control that the laser affords, and the fact that the laser lets us do this procedure through needle hole incisions.
Now, I also wanted to ask you, for the folks watching out there, who would be a typical candidate for this particular treatment option?
The typical candidate, or the ideal candidate for this procedure, is somebody that's already tried weight loss and has lost as much weight as they possibly can via exercise and lifestyle changes. And they come to me complaining of stubborn areas, just those last areas that they just can't seem to get rid of. And to me, that's the ideal candidate for this procedure, where we can help them achieve their desired shape. In general, this is not a weight loss operation, and so this is not for somebody trying to lose 20, 30 pounds.
It's not a substitute for that, no doubt. I don't think anything is out there.
Nothing is.
It really comes down to eating right, proper exercise and diet, and then if you can't lose those few pounds, whether it be like you said in the thighs and you know, the love handles and other areas, those hard to eliminate fat areas, then certainly this would be a great option to get rid of those.
Sure, and this is basically sculpting the body into the last little bit of shape that the patient desires.
Hence the name body contouring.
Body contouring.
Now, as far as results, you've described them thus far as eliminating the unwanted fat from those hard-to-get areas, but what type of results are we looking at here, doctor?
Well, I feel that laser liposuction gives outstanding results in targeted areas of body contouring. Typically, we're able to take down a waistline by several sizes. We're able to make people that want to fit into tighter jeans conform better and get into the clothing that they desire. As far as the neck is concerned, laser liposuction is a minimally invasive way to get rid of the double chin that many patients don't like without undergoing a traditional facelift.
Well, you've described some of the results. I believe you have some before and after pictures from some patients that we can take a look at and see the results.
Absolutely. In this first set of pictures, you can see a patient of mine that underwent lateral thigh liposuction. And this is commonly referred to as saddle bags that a lot of women do not like. And in this patient, we're able to remove those excessive fat deposits and give her the shape that she wanted. The second set of pictures shows another patient of mine who did not like her flanks. Despite numerous attempts at personal trainers and exercise, she was not able to get the slender hourglass shape that she was looking for. As you can see, she clearly is not a overweight patient. However, by undergoing laser liposuction, she was able to better contour her torso into the hourglass figure that she was looking for. This third set of pictures shows some neck liposuction. And again, my typical neck liposuction patient is somebody that's too young to consider a facelift, but is starting to develop a double chin that they don't like. And with the laser liposuction, we're able to tighten the skin through minimal incisions, as well as remove the fat. And this gives this procedure its advantages over a more invasive procedure.
Some very impressive results, Dr. Khalifeh, and what I really found impressive in those pictures is the fact that one doesn't look like something was done. I mean, the after pictures have a very natural looking result.
And that's the key goal, is to always make it look natural and harmonious with the rest of the patient. Nobody's looking here for a very obvious plastic surgery look. We just want to contour the body into a slightly more pleasing shape.
I'm sure it varies by patient, but as far as the length of time for this laser lipo procedure, Dr. Khalifeh, what would you say the typical average time would be?
The typical procedure takes 2.5 hours.
That's it?
That's it.
We're not looking at a half day or whole day affair whatsoever here.
No, not at all. Just 2.5 hours, and the patients need a ride home typically just to be safe, and they're usually off to work in about 24 to 48 hours.
Very good to know, Dr. Khalifeh. Now, as far as follow-up visits, things along those lines, what would one be typically looking at?
I like to see my patients at 1 week after the procedure, and then I see them monthly until the 3rd month of the procedure, at which point we take the final result pictures.
And then they're good to go.
And they're good to go.
How safe is the laser lipo, doctor?
In the right hands, with a trained plastic surgeon that's a member of the American Society of Plastic Surgeons, laser liposuctions is very safe. This is a commonly performed procedure, and because there's no general anesthesia, a lot of the risks involved with the surgery are eliminated.
Well, it's certainly a great option for folks who are looking to lose those unwanted pounds, that fat in those hard-to-get areas that diet and exercise just doesn't eliminate, and to do it in a manner that's minimally invasive, only takes a couple of hours or so, like you mentioned earlier, Dr. Khalifeh, and they're back to work or whatever they want to do within 24 to 48 hours. It's great to have that available now.
Yes, it's been a great addition to my practice, and I'm excited about this procedure becoming more popular and more people learning about it.
Now, we've only got a few minutes left, Dr. Khalifeh, and certainly yourself and your organization, Ivy Plastic Surgery Associates, here in Chevy Chase, Maryland, has developed quite a strong reputation as being one of the top organizations providing plastic surgery services in this region, certainly. And I wanted to ask you, before I let you go, what separates you and your practice apart from so many others?
Well, when my partner and I started Ivy Plastic Surgery Associates, we decided that we would only have board-certified plastic surgeons on staff. And I think vetting out our surgeons to make sure that they've had all the required training from the top institutions in the country and a strong record of safety was at the foremost of our concerns. So our patients come to us knowing that they're in good hands.
Not to mention the reputation you developed for providing quite the personal touch with you and the other plastic surgeons in your organization, of really taking the time with each patient to make sure that his or her needs are truly addressed and the right option is available to them and made available to them. And that certainly says a lot about you and your organization.
At Ivy Plastic Surgery Associates, the patient will meet with the surgeon the same day of the procedure, and there's no intermediary in between. So they can get the facts about each procedure of their interest directly from the surgeon, who knows best.
Yes, indeed. And on that note, I'd like to thank you, Dr. Khalifeh, for a very helpful and informative interview and joining us and being a guest today on A New Me.
Well, thanks for having me here, Rocco. I'll look forward to seeing you next time.
Yes, it was our pleasure.